Bumps under the eyes. The majority notice these little raised spots below their peepers and guess it is simply normal skin behavior. Occasionally, it is. Other times, it represents your lipid levels, leaving a caution sign right on your complexion. Those tiny pale or yellow-tinted nodes resting right below the eyelid might be xanthelasma, which means fatty buildup actually settling beneath the surface. Your system got so overwhelmed by it that it began stashing the surplus where it is highly visible. This is the detail that needs your focus. These lumps are painless. They never scratch. They serve no purpose besides resting there, appearing benign while your blood vessels silently battle the exact same issue on the interior. Not every single lump is xanthelasma. Many turn out to be milia, innocent little protein pockets that indicate absolutely nothing. The distinction is crucial, and you cannot figure out which type you have merely by staring closely into a reflection. Therefore, if those nodes appeared and stuck around, it is not a cosmetic dilemma. It represents a lab workup that needs scheduling.
Spoon-shaped nails.
Your nail plates are meant to arc downward smoothly across the edge of your digit. If they are bending in reverse, that requires investigation. Concave fingernails, wherein the center sinks inward akin to a small bowl, are termed Cheilitis. The textbook case is so extreme you might place a bead of liquid inside the crater and it stays put. This is what generally causes it. Lack of iron. Your system requires iron to construct proper cells. Plus, if it stays depleted for an extended period, even the nails begin growing incorrectly. That stands as the disturbing detail. Once the actual geometry of the plate alters, the shortage has been active for quite some time. This is never an initial red flag. It proves your system has been deprived for many weeks. It might additionally indicate different issues, glandular disorders. Occasionally, it is just genetic and signals zero harm. However, a well-nourished adult eating a proper menu rarely ever develops boles at the tips of their hands. Whenever your tips are bowing down, have your mineral levels tested. Simply that, a single check.
Cracks at the mouth.
You recognize those fissures that emerge at the edges of your lips and reject healing, the type that burn whenever you stretch to yawn or grin broadly. That isn't merely parched texture. It is known as angular cheilitis. Plus, it usually acts as your system raising an alarm regarding what is lacking in your meals. B-complex nutrients, mostly B2, B12, occasionally iron. Those edges of the lips act as one of the initial spots a shortfall manifests. This is the reason it persists. That area remains heated and moist whenever you speak or chew, making it an ideal breeding ground for germs and fungi. Thus, the split tears, becomes infected, and afterwards declines to seal up. You might slather cream over it as much as you desire. When the root is biological, those fissures will repeatedly return. The annoying fact is folks address this for seasons as a cosmetic flaw, whereas it was never related to the skin. Repair what is lacking within the system, and the edges of the lips generally repair themselves quickly.
The ring around your iris.
Stare intently at the pigmented section of a person's eyeball, and you could spot a faint ashy or snowy circle developing along the border. For an elderly individual, that typically means 0. For a youngster, it demands a separate discussion. This halo is termed Arcus, and it consists of lipid and sterol accumulations in the lens surface. Its title actually includes Senilis inside it, since it represents standard aging and the biology anticipates it down the line. This is the trick. Whenever it appears prior to roughly age 45, it acts as a warning for elevated lipid levels or excessive vascular grease. Your eyeball is broadcasting externally what could be accumulating internally everywhere. That represents the spooky detail. It fails to alter your sight in any way. You might carry it for decades while remaining clueless. Meanwhile, those exact types of accumulations continue their destruction in vital organs where it truly counts. So, an ashy circle at 70 means mere aging. An ashy circle at 30 proves a strong reason to contact your physician.
A white-coated tongue.
A faint sheer layer is expected. A heavy, snowy blanket you could practically peel away is certainly not. This dense pale blanket is frequently oral candidiasis, a multiplication of a fungus named Candida, which resides in your oral cavity in small quantities constantly. Under normal conditions, your system regulates it perfectly. Once it fails to do so, the fungus multiplies rapidly. This is the inquiry that counts. What caused your system to fail regulating it properly? A compromised defense network, newly prescribed antibacterial meds, or chaotic glucose levels? This oral infection is not exactly the primary issue. It acts as the arrow aiming at the real issue. For a strong grown-up adult who is currently off drugs, a tongue that becomes suddenly blanketed in pale fuzz requires immediate focus. It frequently serves as one of the earliest visual indicators that your biological shields are operating weakly. The majority of the instances, it means nothing serious and cures simply.
However, a mouth that repeatedly blankets itself again and over is raising a red flag regarding what is failing internally.
Losing the tail of your eyebrows.
This is a bizarre anomaly. Examine the absolute far edges of your brow arch, the section nearest towards your hairline. Assuming that zone is balding rapidly while the center remains thick, your neck gland could be the culprit. It actually carries a medical title. Certain doctors label it the sign of Hertog. The exterior section of the brow arch silently vanishes, and the majority of people point to getting older or heavy tweezing while ignoring it completely. The biological trigger lies in the fact that your thyroid dictates how rapidly your system rebuilds and sprouts cells, which involves follicles. Once it drops pace, your biology ceases funding the areas it deems biologically useless. That extreme corner of your brow sits incredibly down low on that priority ranking. That remains the detail folks overlook. Follicle shedding from your scalp draws attention instantly. A fading brow edge remains stealthy enough to brush off for decades. It typically pairs alongside other hints: exhaustion, added weight, shivering continuously. By itself, it indicates very minor issues. Combined alongside the rest, it justifies glandular blood work.
Dark patches on the neck.
Some folks wash roughly at the nape of their throat for weeks, assuming it is merely grime that refuses to budge. It's never grime, and no intensity of washing will manage to erase it. These deeply pigmented plush zones, typically found on the throat, underarms, or pelvic creases, are termed Acanthosis nigricans. The epidermis hardens and shadows in creases while carrying a fuzzy, practically suede-resembling feel when viewed closely. This is exactly what it is really revealing. It acts as one of the absolute truest external indicators of insulin intolerance. Your system is flooding itself with increasing volumes of insulin to force your glucose levels lower, and that excess hormone commands the epidermis in these zones to multiply rapidly. That represents the concerning truth. This frequently manifests long before you could ever be categorized as a diabetic patient. It serves as the alarm that arrives prematurely when there remains a window to actually fix the trajectory. Whenever zones exactly like this emerge and refuse to scrub away, that is never a cleanliness failure. That remains your metabolic engine crying for help.
Slow healing wounds.
A minor gash ought to seal shut within a week or slightly more and disappear completely. Whenever minor scrapes begin requiring ages to close, your system is revealing something critical about what is circulating in your veins. The primary frequent offender happens to be excessive glucose. Spiked blood sugar wrecks your capillary walls alongside nerve endings as months pass, which guarantees reduced airflow alongside minimal rebuilding supplies arrive.
The injury, therefore, it merely remains stuck, half repaired. This explains why this specific sign is practically hazardous. A large percentage of patients carrying spiked glucose additionally suffer from numbed feeling, particularly across their toes. Consequently, an injury lacks pain, remains totally ignored, and receives zero care until it transforms into a massive crisis. That constitutes the snare. The exact same illness which delays the scabbing simultaneously mutes the agony which would typically force you to respond. Weak blood flow alongside specific nutritional gaps might trigger it additionally. However, a biological frame that becomes abruptly terrible at repairing minor cuts is a frame demanding medical evaluation. Tissue repair was designed to function on autopilot.
Always cold hands and feet?
Certain individuals merely run chilly. That is acceptable. However, if your digits and toes remain dependably icy whereas everybody nearby stays perfectly cozy, that is rarely merely an eccentric character trait. Freezing limbs typically trace back toward blood flow issues or exactly what your plasma is transporting. Assuming you lack sufficient iron, your plasma struggles at distributing air and thermal energy efficiently. Plus, your fingertips and toes located furthest away from the chest get abandoned immediately. This is an additional frequent cause. A sluggish glandular network drags your entire internal furnace backward, plus a stalled internal furnace generates minimal thermal output. Thus, you remain chilly regardless of exactly how many garments you layer up. That serves as the massive clue. It has zero connection to the thermostat settings. It revolves around your system struggling to spark or circulate body heat the manner it naturally ought to. We also see Raynaud syndrome, wherein digits turn pale or bluish during chillier weather because the capillary networks panic. Generally benign, sometimes severe. Regardless, fingertips which remain perpetually frigid deserve a medical consult rather than merely heavier winter wear.
Unexplained bruising.
Every person bruises. You bump against the desk, you earn a spot. That remains standard. Yet dark spots which manifest seemingly by magic, carrying zero recollection of any trauma, represent a vastly separate narrative. Your plasma depends upon thrombocytes alongside coagulation proteins to patch tiny ruptures beneath the epidermis. If you mark rapidly and frequently without any trigger, it might imply that biological protocol is failing to operate correctly. This is exactly where things turn critical. Deficient thrombocytes, coagulation failures, hepatic illness, alongside deficiencies regarding vitamin C or K might each trigger it. During uncommon scenarios, rapid marking acts as one of the initial red flags of a vascular disease. That represents the detail you simply cannot brush off. A mark that you remember acquiring is simply a minor mark. An eruption of spots which you cannot trace back represents crucial biological data. Certain folks mark quicker as they grow older, plus that remains typically benign. However, assuming spots keep emerging across random zones, in groupings, plus you possess zero clue why, never ignore it blindly. Schedule lab tests.
Clubbed fingertips.
This specific sign remains so sleuthy, a majority of folks carry it for decades without ever realizing. Examine your finger ends from a profile view. Assuming they possess broadened and swelled, plus the hard plate bends down across the tip, akin to an inverted bowl, that is referred to as clubbing. The standard check is quite easy. Press your twin pointer digits surface to surface. There ought to exist a tiny diamond-resembling window right where they press together. If that window is completely sealed, that stands as a biological warning. This is exactly what drives it. Bulbous digits are heavily tied toward deficient air saturation within the plasma across an extended timeline. Plus, the standard culprits for behind persistent deficient airflow happen to be the respiratory system and the cardiac muscle. This explains why this specific sign counts massively. It never was a beauty issue. It represents your biology evolving across seasons and decades due to failing to absorb adequate air. Plus, the ends of the digits happen to be where that exact evolution turns visually apparent. Assuming your tips possess silently altered their geometry and you lack no clue exactly when it occurred, that is never natural aging. That represents a red flag to treat with urgency.
Yellow in the whites of your eyes.
The pale zones of your eyeballs are designed to remain snowy. Whenever they begin shifting golden, your hepatic organ is generally the culprit. That golden shade is termed jaundice. It gets triggered by a surplus of bilirubin, a chemical your hepatic organ is designed to filter plus flush away. Whenever the hepatic system is failing or an obstacle is obstructing the drainage, the chemical overflows and dyes the flesh, and the peepers reveal it earliest. This explains why the eyeballs broadcast it prematurely. The scleras appear bright, meaning even a tiny degree of golden pigment pops sharply against that background, frequently prior to your complexion changing. That remains the crucial fact to grasp. This is never a trivial aesthetic shift. A golden shade within the peepers signals issues with your hepatic organ, the biogauche, or the rapid destruction of crimson plasma cells. Plus, none of those conditions are issues you delay treating. A subtle golden hue you possessed since birth might merely be your baseline. However, scleras which have authentically drifted into golden tint demand an immediate appointment with a physician rather than a postponed task.
Pale inner eyelids.
This stands as a test you might execute under 10 seconds. Drag downward your bottom lid margin and inspect the inner surface of it. For a robust individual, that interior border shows a vibrant salmon or red. Assuming it appears ashen, practically the exact identical shade as the complexion surrounding it, take note. That interior lid margin is stuffed with microscopic capillary networks resting near the exterior, making it an incredibly transparent looking glass directly into your plasma. Whenever it appears ashen, it frequently signals deficient hemoglobin, in simpler phrasing, iron-poor blood. This explains why physicians genuinely rely on it. It remains rapid, it's costless, and it functions without any machinery. The color of that mucosal layer mirrors precisely how much air-transporting crimson fluid is currently flowing. That is the highly practical detail. You require zero clinic to secure an initial clue. You merely need a reflective glass and bright illumination. This does not serve as a final verdict by itself, but an ashen interior lid border, particularly paired with exhaustion or panting, acts as a massive push to go secure your mineral levels and plasma volume evaluated.
Ridges across your nails.
Not all fingernail creases signify the exact same issue, and the orientation is exactly what reveals the truth. Striations tracking vertically down your plate from cuticle to edge are generally mere aging. The benign-looking striations tracking horizontally over the plate are truly the ones to monitor. Those sideways indentations are termed Beau's lines, plus every single one denotes a period when your plates literally stop developing correctly for a duration. A severe sickness, a spiked temperature, extreme psychological pressure, or even a brutal round of drugs might each leave a mark behind. This is remaining the spooky aspect. Since plates lengthen at a constant pace, you can practically timestamp the crisis. A crease halfway up the plate stands as a fossil of a trauma your biology endured many weeks prior. That is exactly what renders them crucial to observe. A lone striation could denote a single terrible week you have completely erased from memory. Multiple deep striations spanning multiple plates hint that a much longer crisis was occurring. Assuming indentations are carving sideways through your plates and you fail to identify a cause, that represents your biology maintaining a historical record you never requested.
Relentless itching.
A minor itch is standard. Dried epidermis, a mosquito sting, an untested fabric soap. However, an itch that refuses to subside completely everywhere, carrying zero redness alongside zero clear trigger, is one of the highly ignored red flags in existence. When there is zero external flaw to justify it, the root is typically biological. A failing hepatic organ permits digestive fluids to accumulate beneath the epidermis, and that triggers the urge to scratch. Renal failures trigger an effect quite alike, so might glandular failures alongside mineral shortages. This is the detail folks simply never anticipate. In specific scenarios, endless mysterious scratching urges, particularly the variant that peaks during bedtime or after a steamy rinse, might act as an initial symptom of specific vascular malignancies like lymphoma. That is not intended to terrify you. The vast majority of scratching urges are mundane and benign. However, the crucial term remains mysterious. An itch with a reason is an annoyance. An itch without a reason that lingers across weeks represents a medical inquiry. Assuming your skin feels ablaze, yet there is visually no damage present, stop endlessly grabbing for hydration creams. Go discover the true reason.